My name is Ben Smith. We're here at London Road Community Hospital in the physiotherapy outpatients, and my role is as a research physio. My week is split, so 4 days of the week I'm concentrating on doing some research. I'm an NIHR research fellow based at the University of Nottingham some of those days, and some days here at the hospital, and then I do 1 day a week clinical with patient contact.
Ben started a PhD last year, so he's been awarded an NIHR clinical academic fellowship for his PhD. He's the first person in the hospital to be awarded one of these awards.
We want to reduce burden on the NHS. One of the things I'm really interested in is empowering patients to take control of their own conditions and their own problems so they can self-manage themselves.
He inspires colleagues by his actions, really, so he's very hard-working.
It was a real honour to be nominated and to be recognised for the work that I'm doing. I feel that in a way I'm just sort of representing the department and the hospital, that actually we're a department that is quite proactive and quite forward-thinking in the research that we do.
My name's Otter. I'm a clinical team lead occupational therapist. I work on the stroke unit at St Luke's Hospital in Market Harborough.
Paula has learned very quickly about research. She's gone from very inexperienced in terms of research to knowing an awful lot about research.
I've also been fortunate enough to gain a clinical research associate post with De Montfort University, completing a small piece of research regarding stroke patients. The Research Envoy programme has really opened my eyes. It's given me such a really good experience to understand some of the fundamentals, some of the reasons why we do research. We're very, very busy on the wards. There isn't a moment to spare, and I think the challenge is finding ways to incorporate research, incorporate evidence-based practice into that the busyness of a daily ward.
And she's always asking lots of questions and asking really sensible questions and asking for advice, and is really challenging herself to learn more and more every day.
It's lovely to have the work recognised, really.
Graham Johnson, I'm a consultant in the emergency department and also research lead for the adult emergency department. We've been working really hard for the last 12 months really to try and get research going within the department, and have had a couple of early successes.
Research in emergency medicine is vital. We see such a large cohort of patients, all with kind of very different presenting complaints, and historically there hasn't been a lot of research within emergency medicine.
We are already starting to see some of the benefits, I think, with regards to one of the trials we're running.
Research is really important, and we've got a good culture now in the emergency department of research.
Forward-thinking and vibrant group, they really do inspire us with regard to undertaking some research.
A group of enthusiastic and interested clinicians, get some research nurses as well, and grow the unit and start churning out our own projects, get our own nationally funded trials and things. We've got lots and lots of ideas.
Their drive, their ambition, their desire to make research a kind of core and key part of our department has been kind of breathtaking and inspiring to watch, and I felt that deserved rather than just local recognition, regional and hopefully national recognition.
To see all this hard work being recognised like this is really, really good.